When talking about CFR adjusting, stands for Cranial Facial Release. It's a non-invasive technique that actually uses a small balloon inserted into the nasal cavity and inflate it. It adjusts the bones in the skull. None of these bones are solid. They move in case we have trauma. When there's a misalignment in the skull, it has a different pressure on the brain. Depending where that pressure is, depicts certain symptoms. Some people may have dizziness or brain fog or headaches that they can't get rid of. The longer that pressure stays in the brain, the worse those symptoms get. I see people that have neck pain that I cannot relieve with traditional adjusting, and by adjusting the cranium, it changes how your spine is aligned, and their neck pain, their headaches can go away. You know, most people say you go to a chiropractor and you get the same adjustment every time. You're in, you're out in 3 minutes, and I don't think that's here. I think when you're adjusted here, each visit is kind of like your first visit. We're going to sit down, we're going to talk. What's changed? Things always change. They never stay the same. So every day is different. The adjustment's different. Depending on what happened, it's geared towards the patient. It's a different way of thinking. But I think part of our healthcare problem is everything is focused to just one little area. And I think it's the whole area. It's effective, but you got to be willing to be open-minded to it. When we talk about cranial facial release, we talk about normalizing the cranium. That's done primarily through adjusting one bone, which is the sphenoid bone, which is here. It's the bone that kind of puts the skull together. It creates the pressure that people have from sinuses. That bone is this guy here. This is a patient that had problems holding his adjustment. They wouldn't hold his neck adjustment, wouldn't hold. He'd have some vertigo. It just wasn't effective. You can see this bone has a very strong tip and twist. It shifts his entire skull. This bone makes the orbit of the eyes. You can see it's pulling down on one. This is after a treatment of series of CFR. It normalized this bone, changed the sinus cavity, and changed the structure of his neck. This is without adjusting the spine. What this says is the bulk of the problem typically doesn't start in the spine. It starts above it, which is the cranium. And this is an example of how much can change. This patient now holds adjustments for an extended period of time. I'm not talking 2 weeks, I'm talking more like 4 months. It's not the same. So you can see the structural change that occurs by normalizing one bone. The whole skull has changed its shape. Breathing is a really big improvement for people. People don't realize they're breathing until they actually feel like they're breathing. They didn't realize they were so congested. It's why they wake up with a dry mouth every morning. It's the chronic sinus infection. You lay one way and you plug up. You lay the other way and you plug up. It just never goes away. Living on antibiotics is not the way to do it. And this can change how you breathe. It changes how things flow. People that have a drippy nose that never gets rid of it, that goes away. It's a gentle technique. It's not going to hurt you, but it's something you got to really open your mind to because it's not traditional chiropractic. We typically adjust 20% of the problem with people, and that will get about 80% better. But the difference is when you address the other 80%, which is above the neck, that's your head and the cranium. The results are unbelievable. It's putting the whole body back together, making it as a unit, looking at the whole picture, not just the single piece. You want to treat everything. And I think it starts more in the cranium than it does anyplace else. I have seen things change I never thought possible, and yet I can't fix everything. It's a different thinking. You can't be hurt with it. It's different. I think cranial adjusting has been far more effective in my practice than anything else I've ever done. It's changed a lot of lives. It's changed how I think about chiropractic. Once you experience it, the benefits will outweigh anything you're anxious about. So it's worth looking into.